Good morning, everyone. Good morning. Good morning. We're so glad that you're joining us today. Hope the weather is magnificent wherever you are in our beautiful state. I am really privileged and really excited to introduce Katie Loveland. This is a well sought after training, and we're really excited that she agreed to provide this for us. So, with that, I'd like to welcome you, Katie. Thank you so much.
Awesome. Hi, everybody. Good morning. Glad to be here with you this morning. We are going to spend the next 90 minutes talking about public health grant writing. I'm really going to talk to you about my perspective as a grant writer, about what it takes to get organized, get clarity about the grant that you're going to write, and get your program funded. So let's get started. A little bit about me. I am based out of Helena, Montana. I've been working in public health in Montana for over 15 years. I started out working at the state as the asthma control program manager, and um, a big thing I did for that program was write the big federal grant that continues to fund that program. And then after about 5 years at the state, I went out on my own and started doing public health consulting. I do a lot of group facilitation. I do strategic planning, some policy analysis and evaluation, but a lot of what I do and get asked to do is grant writing. And when I think about grant writing and the business that I've been doing for about 13 years now, um, grant writing is hard. Sometimes when people call me to write a grant, there's like an inner groan that I feel. But I also, when I think about the impact that I've had in my work, I know that grant writing is probably the most impactful thing I've done. I was looking at it recently and doing some calculations with the Montana Healthcare Foundation. And kind of came up with the number that I think I've brought in about $100 million of funded projects into the state of Montana for public health. So, that's a lot bigger impact than I probably had in any other area of my work. And so, um, when I look back on it, I think grant writing really does matter, and you have to have the funding to do the work. So that's me. Glad to meet you all. And let's get started. The thing I really want to say today is that grant writing is not rocket science. Like, I sometimes laugh because I think, do people really want to pay me to do this work? Because it's pretty, sometimes it feels so basic. It's just getting a really clear list of questions and answering them, And so I want to kind of demystify the process and want to let you know that I really do believe that grant writing is something that any public health professional can do as long as you have clarity and a good plan in front of you. So successful grant writing is not rocket science, but it is 5 things. I'm going to kind of break this talk into 5 different areas. It's finding the right fit. A big piece of grant writing is writing the right grant to fund the right project. Um, it's about getting really clear on what your funder expects from you and then developing a plan to meet those expectations. It is concise, structured, technical writing, and that is the rub, right? People hate to write. I always think I've built my whole business on the fact that people don't like to do technical writing and they don't like to do math. And I just think we have to kind of face that that's the hard part, is just getting words on paper, and I'm gonna talk to you about some of the things I do to get in the right space to get the writing done. And then it's also about using data to make your case. And I think that can be a challenge for us sometimes too. How do we really get the right data to justify the need for the funds? So that's what we're going to talk about. Let's start with finding the right fit. So there's lots of different types of grants. I've written all of them. There are private foundations that provide funding to public health programs. There's often some local funding that you will access either from your city or your county. Sometimes it's pass-through funding, so it's kind of federal or state funding that's funneling down locally. Sometimes localities have their own public health funds. Missoula and Billings, I think I have mill levies that provide some local funding. So that is funding that can be vied for. The state of Montana has quite a bit of funding that also often is also passed through, but sometimes it's directly from the state general fund or from the tobacco prevention settlement, the opioid settlement. There's other sources of funding that come directly from the state. And then a lot of public health funding is federal. Now, this is not a perfect graph, but I was thinking a lot about how as you go up this arrow here, the degree of difficulty for writing the grant often gets higher. Private foundations, I love a private foundation grant. Sometimes it's only a couple pages of writing, really, once you answer the questions. They often have a grant portal, and if you really go in there and write a Word document that then you're going to dump into the portal, it's 2, 3, sometimes 5 total pages of writing. Federal grants. I wrote a federal grant recently that was a 50-page narrative, single spaced. It was a 10,000 word grant. And I just thought, who wants to review this to start with? But it literally, sometimes as I was writing it, I was like in the depths of despair. I'm like, this is like pulling teeth. It was just so much. And it was so circuitous. There were so many questions to ask. There were so many moving parts. But also the amount of funding goes up. I think that federal grant was for, $10 million. And so, of course, they're going to justify a long and complex narrative to get that level of funding. Hopefully, private foundations give you enough funding, but sometimes it's only $5,000, $10,000. And so you shouldn't have to write a super long grant to access those kind of funds. The other piece is reporting requirements. Federal grants often have pretty complex reporting requirements. Really pay attention to those, what you're going to have to fill in and how often. But sometimes private foundations will try to give you a ticky-tacky amount of money and then have quite onerous reporting requirements. So you want to pay attention to that too and kind of assess your capacity and how much it's worth. So think about how hard it is to write, how much funding you're actually going to get, and what reporting is going to be required. So a lot of you in your intro kind of questions as you signed up for this training really talked about the challenge of finding grants. And I agree that that is a challenge. And as a grant writer, sometimes I tell people that's not my job. Like, you find the grant, then come to me and I'll write it. But I have done some work with finding grants and trying to assess what grants are available. I am also the chair of the board of our domestic violence shelter here in Helena, and we think a lot about funding for that nonprofit. And so, I think a big piece is aggregators, so search engines. And we'll talk later about AI is also kind of transforming this space, but really finding the websites that allow you to go and search for funders. So this one is called Candid. Candid. It used to be called the Foundation Directory, and then they merged. This is when I had a subscription to it, it was about $50 a month. Now, I think it probably has gone up since then. But what it allows you to do is really look deeply into the foundations that exist that might be funding in your space. If you're going to use this website, I would recommend going in, subscribing for a single month, and doing a real deep dive, because most foundations fund at a certain geographic area and they fund certain types of projects. And they have a set endowment that then tells you how much they have to give per year. And so that's not going to change a bunch. You don't need so this is not really about finding grants, but it's more about actually finding the funders that are out there that you could approach and talk to. And so for the Friendship Center, for instance, we did a whole really deep dive, and we kind of said there's really only about 8 funders, foundations that we can approach that really fund in our space, in our geography. And we now have a deep sense through this directory of um, who to contact and how big their endowment is, and do they fund capital projects. So it gives you lots of details specifically about each foundation and how many awards they give out, and how big their endowment is. So really worth looking at that grant aggregator. Then that's a foundation aggregator. This is a grant search engine. So there's several of these out there as well. This is called Grant Watch. This is where you're actually looking for active grant opportunities. So you can start searching keywords, you can look at locations, and really start to look at what grants are available. And you might be surprised. There might be some national foundations that have awards. A lot of these also include the federal grant opportunities that are out there. And so it's worth looking at those search engines. Again, often these cost. So that's just something to be aware of. Sometimes it's worth paying for it for a month and seeing if it's a useful search engine for you or not. But that's going to help you find some grant opportunities. So in the chat, I would love for people to say if you have used a grant aggregator or a search engine, and if there's one that you have found valuable. I'll talk to you a little bit about foundation funds. There's kind of a couple paths to go get foundation funds. Most foundations have calls for funding. Often they do it a couple times a year. They'll have cycles where their board gets together and reviews applications. So they'll open the call for funding, people will submit applications, their board will review. And the foundation center or the Candid aggregator might tell you that. And, it's worth looking at those RFPs and submitting application. But for the most part with foundations, I would recommend path two, which is relationship building. So if you're interested in getting a foundation fund, um, uh, I would find out who to contact. Most foundations have someone who's like a front facing person who meets with organizations. And what you want to do is you want to sit down with them and say, tell us more about your foundation. What do you fund? When do you put out calls for funding? What kind of projects are you most interested in? And what you want to do is build that relationship with them. Then you want to say, this is who we are. This is our mission and vision. This is the exciting work that we're doing. And you want to start to understand how what they fund and your work might align and where your missions might align. And what's going to usually happen after that, if there tends to be a good fit there, is that they're going to say, hey, why don't you apply next time? Like, next time we have an open round of funding, sometimes they might say, you can just apply right now. We always have the ability to accept an application for a $10,000 project, an innovative project. But it really is going to be about sitting down with that foundation, getting to know them and understanding that mission alignment. I would recommend doing the relationship building even before an open call for funding so that when that application comes into that foundation, they're like, oh, yeah, we met with those guys. We know them. We know their work. So, really, really often a relationship forward approach when it comes to foundations. There are a couple of key public health foundations in the state of Montana. The Montana Healthcare Foundation, they fund statewide. I do a lot of work with the Montana Healthcare Foundation. They have very specific projects that they fund and open calls for funding several times a year. They're really one of the major funders in the state of Montana. I'm sure many of you have worked under projects funded by the Healthcare Foundation. Um, Again, they're really worth getting to know. Get to know their project officers. If you're starting to do behavioral health work, talk to Scott Malloy. If you're working with Native Americans, talk to Trustee White. You want to get to know their people, sit down with them and explain what you do and who you are. The Headwaters Foundation funds in Western Montana and does some work statewide, I think, especially with Native folks. Again, each of these foundations have like different focus and different things that they fund and support. The Headwaters Foundation has funded a lot in the early childhood space. The Montana Healthcare Foundation has funded a lot in the kind of turning on Medicaid funding space. So doing pilot projects that then can help people access different forms of Medicaid funding. They've also done a lot in the behavioral health and crisis space, supportive housing. So everybody has specific areas where they fund, and you really kind of need to get to know them and what they're interested in spending money on. Denison Phillips Washington is not a specific public health foundation, but they are a very large private foundation based in Missoula. They do some funding statewide. Um, they like to fund kids projects, and are just good to know about because they have such a large endowment. If you're doing things in Montana, you will notice that they fund a lot, and they're worth getting to know. One hint to be aware of, and that's because I know this because I do it all the time, is that Montana Healthcare Foundation often will fund grant writers. That's just one of the things they like to do. They have a whole team of grant writing consultants. I am one of them, that they will approach and say, hey, we have a grant that one of the organizations in Montana wants to apply for. Will you partner with them and help them write that grant? They've changed the rules about that at different times. Right now, they don't like to fund applications where there's multiple organizations competing. But if you're an organization going after a grant and no one else in the state is going after it and competing, but it's a kind of big grant and you want some help, it's worth approaching the Healthcare Foundation. They often will throw some money at actually getting you a grant writer, a professional grant writer. So that's some foundation thoughts. This is the state procurement portal. It's very strange. I laugh because I do state grants and it's the most strange system to apply for grants. One thing I'll say about foundations is most foundations have their own portal that they use. So you have to, if you're going to go through the Denison Phyllis Washington Foundation, they have their own website and their own portal, and you will get a login, and their solicitations and the forms you fill out will be inside of their own portal. The state has Emacs. This is where they post all of their requests for proposals for the entire state. So there are requests for proposals for, like, people to do construction of roads, and people to do testing assessments for OPI on this website. But it's called Emacs, Montana Acquisition and Contracting System. If probably, like, if you are a local public health department, somebody in your county is on Emacs and is getting requests for proposals regularly. I am logged in as a vendor on Emacs, and if you log in on Emacs as a vendor, you can click what you're interested in. So I say public health, I say data and evaluation, strategic planning, and literally every day I get emails from Emacs that say there is this new RFP out for this, and often it has nothing to do with what I'm interested in or what my business can do. But I'm aware of kind of what's coming out on Emacs regularly. What's hard, I think, sometimes if you're a local public health programmatic person, is you might not be the person logged in here and getting those emails. And so sometimes there's these funding opportunities that are coming out for public health that you might not be aware of because they're kind of being sent to whoever is your county's procurement person. So it's a little bit strange. So find out who in your jurisdiction gets the Emacs solicitation emails. Know who that person is, and know who in your jurisdiction submits these state RFP requests. It's a weird system. I don't know if any of you have ever applied for or responded to an RFP in this system. You go in, and there's just all these links, and there's often like 10 Word documents that you download, and they're kind of hard to follow, but you have to go, and it's not very clearly labeled, but there will be at some point questions that you have to answer. So you download a Word document with the questions, you answer those questions, and you re-upload them. And you have to do all these things. You have to kind of say that you're not discriminating and that you won't discriminate against gun manufacturers as a new state. So there's different things you have to click on and agree to, and you have to insert your budget often. But this is the state procurement for RFPs. We're not going to go deep into it, but it's really worth understanding that that's where state funding comes from. Another thing to understand is that the state has procurement limits. I'm very aware of this as a contractor. So state programs who have funding and just want to fund a project, like a pilot project, they can sole source a project up to $25,000 and give money. And most local health departments have a master contract with the state that they can add in money for other projects. And so if they just have a one-time project that they want to fund for you, they can add that into your master contract without having to get bids. If they have a project up to 100K that they want to do, they have to do a limited solicitation bid. So they only have to do 3. They can send it to 3 different vendors. And then they can fund a project up to 100K, but anything that's over 100K or more annually has to go out to an RFP. And if they're doing something competitive, right? If they're saying, local health departments, we have a $50,000 project for you. You can do a tobacco prevention project, but you have to compete for it. We only have 5 awards to give. They still are going to do an RFP for the most part because it's competitive and there's multiple awards. So they need to have some sort of a process, and that will go through Emacs. I was talking to the state opioid program because I do a lot of work with them, and they were talking about how if they have less than $10,000 for competitive money that they want to send out for opioid prevention little projects, they can do not through Emacs. They can do a mini grant up to $10,000 that they just email out. Doesn't have to go through Emacs, and they can provide less than $10,000 competitively. But if it's competitive dollars over 10K that are from multiple public health departments or public health programs, it's going to come through Emacs. Clear as mud system. This is federal grants. This is on grants.gov. This is the portal for all federal grants. So same thing. There's Health and Human Services grants here, but all other federal contracting as well. Federal grants require that you register with SAM.gov. You should, if you're a county that is getting any federal funding, there's somebody who's registered with SAM.gov. But that's very important. If you're going to apply for a federal grant, it takes a while to register for SAM.gov. It's actually a pain in the butt, I know, because I'm on the system. It takes time. And so that is like one of the first things you need to do if you're going to apply for federal grants is get your organization registered with SAM.gov and figure out if you are, if you are a county, who is the person who is registered with SAM.gov, knows all of your ID through that system that allows you to apply for federal grants, and then who can submit into the grants.gov portal. It's usually not going to be each program person. There's usually somebody in your county or organization who submits those grants. But you can search for grants in here. You can search for grant opportunities. You can see, there are just often thousands of federal grants available. Right now, the federal funding landscape is really in flux. I think you all know that. I definitely am aware of that. It's really strange if you go onto grants.gov right now and look at the grant listings. Almost all of them say postponed. I don't know what's going to happen with federal grants and public health. It's actually very concerning to me. I was saying before we got started that the other thing is they're putting some pretty strange language into federal grants now, and you can't file lawsuits about that language if you think it's illegal until you receive the funding. So a lot of funding is delayed, and then what we think is going to happen is that when programs do end up getting funded, that it's going to trigger lawsuits that will further delay the funding. So I think we're in a time right now in public health where we really need to think about how to be resilient, how to stretch our funding and be creative about our funding. I hope that this will be like a short blip in time where because federal funding has really been the consistent bedrock of a lot of what public health has done. And I'm just not really sure what's going to happen with that. So I wrote 2 federal grants in March. And I said, are these even happening? And they were submitted, I believe. I have not been approached to write a grant since then because I think so many grants are in flux. So it's a really strange time. And I'll just leave it at that. In terms of finding grants, I think it's actually really hard to go to the Emacs and go to SAM.gov or grants.gov and actually try to figure out what's available. But there are lots of good newsletters, and even from the state where you want to get in with these groups. This is like AHEC, the Area Health Education Center, MSU. They send out a weekly newsletter, and one of the categories every single week is funding awards and opportunities. And they do a really nice little summary. Here's a rural health small grants. They tell you when it's due. They say it's from the Montana Healthcare Foundation. They give you the link to the webinar. So they've done the work. They've found a funding application and they're sending it out and saying, hey, think about applying for this. Okay, here's the American Heart Association. They have funds for food banks. So if you're a food bank in a pantry, awesome. That's something to think about. So I actually think the main thing I think is needed for finding grants is to get on these newsletters and get on people's radar that you are a public health organization that needs funding and to really look through these newsletters that get sent out and pay attention when these funding opportunities come across your desk. So in the chat, I would love to see what folks do, if there's other newsletters that you follow that you find useful in terms of finding grants. I don't know. One that I really should be on is like, is it Convergence? Confluence, the Public Health Association for Montana. Um, I imagine they have a newsletter. I don't know if they aggregate some funding opportunities and get those sent out. I know the Behavioral Health Alliance of Montana sometimes will send out things like that. The Montana Healthcare Foundation has their own newsletter and they'll push out, hey, we have funding opportunities coming up. So, you want to get those emails. You want to see what's coming across your desk in terms of awards. And when funders have money and RFPs, they want you to know about it. They don't want it to be a secret. They want good applications to come in. And so, just think about different ways you can make sure you're on the radar and getting that information. Because the worst thing you can do when you're, writing a grant is find out 3 days before it's due. It's available, right? You want to be on it. You want to know usually that a funding opportunity is coming down the pike. I'll hear the state, and this is another little hint. The state, once, if a program is developing an RFP, they're going to put some funding out. They can talk about it and be like, hey guys, we have some funding coming out. Be looking on Emacs, something's going to get posted. The moment it is posted, they cannot talk about it at all. They cannot answer questions about it. They have one point of contact on Emacs that you can talk to, but it's often not a person in the program who knows what's going on. So you need to be friends with the folks at the state that are passing money down through. Like if you're doing some asthma work, know the asthma control program at the state. If you're doing opioid overdose prevention work, know, the overdose to action people at the state. And they have funding that's going to come out and they want you to know about it. But as soon as it's posted on Emacs, they have to go totally radio silent. It's actually quite frustrating. So you want to talk to them in advance. They often will have a webinar as well to let you know about the funding. Those can be helpful. And so, they'll post it. They have to go radio silent, except for the webinar that they share with potential funders. So, okay, there you go. All right, so you used your aggregator, you got the email, you found the application. You're thinking, maybe we'll apply for this. Maybe this is a good fit for us. So now what do we do? The next thing that I think is really critically important is to get clear on what the funder expects from you as the grantee. So the biggest mistake that I see in the grant process is trying to apply for a grant that is not the right fit. As a grant writer, sometimes I almost after my first meeting want to sit down with the people and be like, are you sure this is a good idea? Because sometimes I can tell after one meeting, there's no chance in hell that you're getting this grant. And, it's a lot of time and effort and work, even if you have a grant writer to put a grant together. And it's really important, I think, to have that initial go, no go decision making at your programmatic level to decide if this is a good fit for you. So some really high level things I always look at and review with my clients. One is eligibility. It is always very clear. Federal grants will have a whole section of eligibility where they will tell you who can apply. They will say, this is for tribal health departments, local health departments, and nonprofits, or this is for urban Indian health centers. So really, the very first thing is to just say, are we one of the organizations that meets the eligibility criteria? The next thing you want to look at in conjunction with eligibility is the number of awards and award amounts. This is really important because that tells you a lot about your competitiveness, right? If the eligibility for this project is state health departments and there are 50 awards, then you basically know that this is almost a non-competitive application. As long as you apply, you're going to get it. But if the eligibility for this award is every single health district or every single school district in the United States, that is literally thousands of school districts, and there's 5 awards. You better be so advanced and be at the top tier in the whole United States of this work, or it's really not worth it to apply. So you want to kind of pay attention to what would be the universe of eligibility, how many people could actually apply for this award, and then how many awards are there? Is this going to be only 1% of applicants are going to be awarded, or you know what, there's probably going to be, there was a recently uh, state funding award that was coming to local health departments that only for people, health departments that had 10,000 residents or less. And it was through the Montana Public Health Institute, and they were kind of begging people to apply because they were like, oh, we know it's these small health departments. We know they don't have a ton of capacity. We have these awards. We want to get them out. Somebody please apply for this funding. And so knowing that, hey, there's only a few health departments that are eligible. They don't often have a lot of capacity. They have 10 awards. Like, let's go for it. It's if we submit an application, we're going to get it. Then you want to look at the required activities. This is really important. Because often it's like you want to fund this thing, but the funder is funding very specific required activities. And the required activities are things you actually have to do. There's often allowable activities. Those are often more fun. Allowable activities are great, but if you can't meet with the funding that they're going to give you, if you can't actually perform the required activities, then you really shouldn't go apply for the grant. Then you want to look at allowable and unallowable costs and what cost sharing is required. Again, oftentimes people will have a project where they really want to buy a lot of equipment or they want to build a building. Well, many foundations, especially, do not fund capital campaigns. And so you need to look at their open call. And if they say no brick and mortar, you cannot do a building with this, then don't ask them to build a building. It's an unallowable cost. A lot of federal grants have very strict parameters of what you can and cannot fund. They're getting real strict about funding food, for instance, so don't say I have a coalition and one of our main costs is going to be food every month if it's an unallowable cost. The other thing is cost sharing. How much are you supposed to match or show in-kind cost sharing in order to be able to justify this grant? And really take a good look at that. Are you actually able to do that? That's important. Staffing requirements is also important. Almost every grant is really specific about you need a 1.0 FTE project manager and a 0.5 FTE evaluator. And you need a project investigator, and they can be in kind. I mean, it'll just be laid out there. Bam. Now you can fund often more staff than that. Like you could do a 0.75 FTE evaluator. But if you can't meet those minimum staff requirements, if you can't say, okay, we can take the staff we have, shuffle them a bit, or actually we think we can hire an FTE or half net FTE, whatever that is. But if you can't meet those staffing requirements, then again, it should be a no-go. And then really look at reporting. As I said earlier, sometimes it's really onerous. And like you have to think about, do we have the data staff? Do we have the evaluation staff to actually meet these reporting requirements? So those were the things I would look at. And I would almost make a little like decision-making matrix. Are we eligible? Are we competitive considering the number of awards? Is it even like worth our time? Can we do these required activities? Is what we want to fund an allowable cost? Do we have the cost sharing? Okay, staffing. Can we actually get there and meet the staffing requirements? Is the reporting requirements and doing that work, is it worth it for the money we're going to get? And the big thing I would say, so questions to ask, I guess I already talked a little bit through this, but really does it align with our mission? Sometimes I will work with clients and I'm like, oh, this sweet executive is just desperate they're chasing money down. And they're like, okay, this is just funding available. Let's go get it. Come on, staff, let's go get it. But it's like, this is not your mission. This is not really what you're doing. It's not what you're about. You don't have the expertise to do this. Actually, if you get this grant, it's going to take all of this interest and attention away from your actual mission. It's going to send you in a totally different direction. Don't do it if it doesn't align with your mission. We call that mission drift, when people are like just chasing funding and not really staying on mission about what they want to do. Do we have the capacity to implement this well, right? And sometimes when I write a grant, I laugh because as a grant writer, you're calling me up because you need capacity to write the grant. That's fine. If you don't have that technical expertise, if you're just feeling overwhelmed as an organization. But then it also makes me question, do you have the capacity to implement it, right? Because if you're struggling to find the bandwidth in your organization to write the grant, now you're going to get this money. Are you going to be able to hire and then have the staff to actually do it? Great. But if you're going to try to maintain your current staff and you're already overloaded and you're already stressed out, and then now you take on this big project with all these required activities and all these reporting requirements, are you really going to be able to implement the grant and do it well? Is the money worth it? We talked about that. Consider the reporting requirements. And then that question about the pathway for sustainability. The hard part about grants is that they come and then they go. And so what's the pathway to sustainability? The hard thing, I think, is that federal grants often were like, wow, if you get this big grant, it's a continuing grant and you're going to continue to have, for instance, the asthma control program funding that's going to fund that. That is getting broken a little bit right now, that federal sustainability. And so that question about if you're going to ramp up to a big project, hire some people, what might it look like to sustain them? Often it helps if you're braiding funding, if people are working on multiple projects. And so then if you lose one source of funding, their FTE is funded with these other sources, and maybe you can move an evaluator over to another grant. And sometimes getting multiple grants allows you to build like that evaluation or epidemiology capacity in your organization, and then you can keep kind of using that capacity in different grants as you piece that together. But really ask that question. I would really recommend just being proactive and not reactive in your approach. You want to say, we are on mission. We know what we're doing. We have clarity of what we're wanting to do. And we're going to go find funding that meets what we want and what we know we need and what our community says we need. Not, oh my gosh, we're struggling with funding. We're in crisis. Whatever funding we can find, we're just going to apply for. That's that reactive approach that I really get concerned about when I work with clients. I think the foundation question is hard because mission alignment is a challenge. Foundations are often kind of, they do their thing, and they're in a kind of a narrow space. And sometimes you're trying to little bit fit the square peg in a round hole with mission alignment. But you can do it. Sometimes it's like you have to figure out a piece of your project that aligns with that funder's mission that they would like to take on. The Dennis and Phyllis Washington Foundation loves to fund stuff for kids, and so maybe there's a piece of your project that's really youth focused that you can get them to take on and then find another source of funding for the rest of the project. So that work is challenging sometimes. And sometimes you're like, we have such good work we're doing. Why aren't funders interested in it? But sometimes again, that relationship piece, they'll say, you know what, this is a good project. It's maybe not totally in the scope of what we say we're about, but maybe you can convince them. Maybe you can get them to really understand what you're about, why it matters, why it's important to your community, and bring them along with that. But it can be a little challenging. Probably shouldn't have a public health presentation with someone with a cigarette. Don't bring a cigarette to your public health foundation mission alignment meeting. That's my takeaway. If the grant is not a good fit, this is, we know this wasn't a great public health approach just to say no to substance use. But as an organization, I just really admire when people come to me, sometimes even after they've engaged me as a grant writer, and they've just said, we've really looked at this now, and it's just not going to be a good fit. We can't make this work. I actually really admire that, because then we're not wasting each other's time, and you've really done that assessment in your organization about what you can and cannot take on. Okay, so you've done your assessment, you've done your decision-making matrix, you found this grant, it's a great fit, you feel like you have the capacity to do the work, you're excited about the project. Now you just got to get a plan together. You have to have a lot of clarity. And I'll tell you this too. When I get linked up with a client for grant writing, in the first 10 minutes of the conversation, can tell if this program has a plan. And I can tell if this is going to be an easy grant to write, because they're like, okay, this is what we're going to do. We've read the grant. We know what we're doing. And then I can be like, awesome. Let me have a 30-minute conversation with you and we can get most of this grant written. Sometimes I get in a call and they say, we found this grant, we're going to write it. And we spin our wheels for 45 minutes. And I realize, whoa, they have not read this grant carefully. They have not gone through a clear decision-making process to make a plan. And this is going to be a nightmare. So I want to beg you not to go down the nightmare path of grant writing, and really think about clarity and having a clear plan. So you kind of need a plan for two things. You want to really know, how are we going to use these funds? We're going to get this money. What are we going to do? And then you need a plan for how are you going to get this proposal written, So there's kind of two things. It's kind of the like, what are we actually going to do if we get the money? But then how do we actually get the proposal like put together and get it submitted. Who can do those things? Program staff, administration really need to be at the table for the how do we use the funds portion. With the proposal piece, if you want, that's where you can bring a grant writer in. But here's what I'm trying to say with this slide is a grant writer cannot tell you how to use the funds. That is such an important programmatic decision. It's about your staff. It's about your capacity. It's about your partners. So the idea of like, I'm going to hire a grant writer isn't going to obfuscate that first step. There's actually a lot of decision making that needs to happen in that first step. And what the grant writer can do is then take that decision you've made, how to use the funds, and develop a proposal for you. So just want to be clear on that. So you got to get that plan for what you're going to do. And so I say start with those required activities. Like sit down with your program staff and be like, okay, this is what we got to do. What would that look like? One of the required activities is having a youth council. Do we already have a youth council we could use for this? What would it look like to develop one? Who would be our partners in that youth council? How are we going to make that happen? Talk through it. Another required activity is to put on 4 trainings a year. Okay, how would we do that? Who would be the person in charge of it? What trainings would we think we were doing? So tick through those required activities and do that who, what, why, how for those. You really got to start having the budget conversation really early. What is the budget? How would we allocate the budget? What's allowable? Get your finance person at the table and start talking about that at the very beginning. Then the staffing requirements. Okay, if we have these required activities, who's going to do it? And we might be able to do it without what's required by the funder, but the funder requires this. So we actually have to have these staff. So who's going to have that title, even if it's not officially in their job description for this grant, who is going to be the project manager, you know? And then how are we going to track our project progress? Like, what is it actually going to look like? This sometimes, you know, I'm in the contracting world, and sometimes it's like, okay, we're actually going to need to get an evaluation contractor. Let's call up, you know, one that a lot of people use is JG, Research and Evaluation of Bozeman. Let's call them and say, hey, this is a complicated SAMHSA grant. It's going to have all these clinical reporting requirements. Could you do this for us? Then you want to start asking like, okay, if we're going to have a contractor, what is it going to cost us? If we're going to get our 0.25 FTE evaluator is actually going to be a contracted evaluator, what's that cost? So then we got to put that in the budget, you know? So you got to start putting all these pieces together. When you have clarity on this is when you can start writing your proposal. And again, as a grant writer, and maybe talking through this, I'm like, am I a brat? But no, I'm all about really streamlining. I'm like, I don't want to waste your time. I don't want to waste mine. And so if I'm sitting on a call with as a grant writer and someone's still like really talking about the budget, they don't have any idea how they're going to manage their what the budget's going to look like. I'm like, call me when you're ready. You know, when you've made some decisions about the budget, when you're clear about the staffing, when you have a plan of what you're going to do, that's when you can pull me in and we'll get this proposal written. But until some of those decisions are made, there's no use to try to write the grant. You got to make a plan first, you know? So that's kind of the critical first step. I always talk about alignment. I always say these pieces need to talk to each other, right? So the requirements of the grant, the goals and objectives of the grant, the budget, the work plan, and then finally the staffing plan, and finally the narrative, they all have to make sense, right? If I'm a grant reviewer and I'm looking at your work plan and I see all the stuff you're going to do and the staff on the work plan, but then the budget doesn't actually justify the work, like, and then the staffing plan isn't adequate to actually fulfill the work plan, and the goals and objectives that you're measuring don't align with the work you're saying you're going to do, then it's a mess, right? But if there is clear alignment, like, oh yeah, here's the budget. Well, that makes total sense because the budget is funding the staff they say they're going to have, and that is adequate to fund the work, and it's going to, and if they do the work, it's going to meet the goals and objectives, and they have a plan to measure it, and that meets the grant requirements. Boom, funded, you know? So that kind of alignment and high level thinking, and let me tell you, some people are great at that and some people struggle. And you probably know you're the person who does that. But if you're not, if you're a detail person, if you're like, I just do my program, I'm in the weeds, I don't like to think about strategies, I don't like to think about goals, then you need to bring someone in who can help you high level this and make a big overarching plan where everything is aligned. Then once you have some of these pieces that are aligned and clear, the grant narrative is easy to put together, right? And it should clearly link to, expand upon, and mirror each of those above. So then the narrative is almost just like expounding upon these other pieces, okay? And you need that plan, and you need the agreement and approval of your administration to do this plan. And then you can write that narrative. So this is just my suggestion. This is how I do it. I pull up a proposal, I read the whole proposal. That's important. Sometimes I work with clients and I'm like, bless you, you got that email, you read the 1 paragraph summary and you're like, this looks great, but did you actually look at the proposal and read it? The hardest part about federal proposals is they're often like 80 pages long. I mean, truly, like why? Um, but you want to actually look at the entire proposal. And I'll tell you, I ignore most of it. I do one read through so I know what's there. I pull out the very key pieces, mainly the purpose, the questions that I need to answer, the pieces that need to be submitted. And then so much of it is just boilerplate garbage, right? So don't be intimidated if you get a federal grant and you download the application package and it's 90 pages long. Because trust me, there's usually 3 pages of questions that you actually have to answer and some attachments you need to pull together. So that's why I say ignore most of it or don't be intimidated by the whole size. Then I take the proposal and I make a simple outline. I'm going to show you how to do that. And then I make templates for each required element of the grant. Okay, so that's what I start to work from is my little outline of what the grant requires. I send my clients the templates. We got to fill these in and that's what I'm working from. I'm kind of not using this 90-page document that has a lot of language that doesn't even isn't relevant for what we're going to do. Then we gather our team together and we delegate the tasks. So again, I tell people I'm writing the narrative, I'm writing your abstract, I can get your work plan together, but you have to tell me first, what's your budget? What's your staffing plan? You're going to have to chase down some of these attachments. These are partner letters. I don't know them. You have to. So even if you have a grant writer, it's not like, well, we can just offload all of this. It's like, no, you're going to have a team that's meeting and getting this together. Then the first 2 things I talk about is get that budget together and get that work plan together. If we have those 2 pieces and they're talking to each other and they're clear, then we're a lot of the way there. So start with that. And we have templates for those. So I give people like, here's our budget template. Who's going to fill this out? And I always say too, a grant writer usually can't do your budget because you know how much your staff are paid and you know what their FICA costs are and what your rental costs for your offices are. And so it really usually takes a programmatic person to do the budget. Then you want to look at that formatting and page length requirements. I'm always super careful about this. When I make my templates and I make my narrative outline, I exactly follow the formatting and page length requirements. They often tell you what font to use. They tell you if it's double spaced. They tell you what your graphs and your tables size can be. And so I just create documents that are already exactly in the right format so that as we're filling it out, we don't think, oh, we have plenty of space left. Just kidding. We were writing that in 10-point font, and when we change it to 12-point font, we're over the page limit. No, don't do that to yourself. So pay very close attention to the formatting and page length requirements. And then you develop this narrative shell that is exactly according to the format and page length requirements. And you just start to fill that shell in. You just start to answer the questions in the narrative one by one as best you can. And then at the end, you gather all those pieces together and you use the scoring criteria that's provided in the application to review it all, and you submit early. I'm going to get into all of this, but this is how I kind of think about writing a grant and these kind of steps. So grant writing tasks, right? Again, I hope I'm not on this high horse too much, but I think as a grant writer, I think a lot about how you really still need that team and it can't just be the grant writer. So at your executive level of your organization, they have to tell you if you can apply or not. I every once in a while have written a grant that at the very end, they actually ask the people who can decide if they can apply. And it's like, no, no, we just spent so much time, and they're the ones who can often approve your budget and FTEs. I know at the state, that's a huge issue, get FTEs approved. Sometimes they have to get approved through the state legislature. So do you have the staff? Can you make it happen? At the admin level, they're the ones who can assess the fit for the grant. They can think about mission alignment. Is this really the right thing for the mission of our organization? And they can also help you at that high level think about what are the goals and objectives of this grant. At the fiscal level, those are the people who are going to develop your budget and can help you think about, does this budget actually align with the work? So that's super important. And then at that program level, that's often the person who I'm working with most. So they're the ones kind of talking at those higher levels, making sure they have approval, making sure that it's a good fit, making sure the fiscal person is working on the budget, checking that. But then at the program level, that's where you start to be thinking of the actual work. So I don't always make my program people develop a work plan. If they can give me the bullets of what they're going to do, I can develop a work plan for them. But sometimes they want to just take a crack at their work plan and say, hey, this is what I'm thinking, you know. I really do have the program people look at other attachments because they're often letters of support, things like bio sketches for staff. For federal grants, there's lots of just ticky-tacky fill-in SF 242 form. Again, I don't think that's always a good use of your grant writer's time. You just want the program staff to fill in. It's often organizational information and federal approval to not do lobbying, things like that. So attachments are something I often have program staff work on, especially those letters of support. And then that grant writer. So the grant writer, and again, if you're a program person, and you might be the grant writer, you know, so then you start to work on writing the narrative and the abstract, especially the actual writing part. And then you really got to keep track of all these other pieces, you know. So we're writing, the big chunk is the narrative and the abstract, but you cannot submit unless you have that budget, have that work plan, and all those other pieces together. You know, a lot of this I am talking about is federal grants. Um, Sometimes with a foundation grant, they don't require a work plan. Their budget is real simple, you know? So it's not always this many layers and levels, but often there's these pieces required to get a grant submitted. Okay, so you're like, we're gonna write this grant. We have this RFP. The big thing I would recommend you do is take that RFP and custom create some documents. I was telling the folks before I got in that I thought about making handouts for you with templates, but here's the problem. Every grant is so unique and different that I can't make a work plan template for you. You have to read the RFP and make a work plan template that exactly matches what the grant requires, right? So you make a simple grant outline. I'll tell you the pieces I put in my grant outline. You're going to make a narrative shell that you're filling out. I'll tell you what pieces I put in my narrative shell. You make a template for your work plan. You make a budget template and narrative. What's nice is sometimes the grant will include a work plan template already for you, and often they have a budget template and shell ready to go for you. And then you draft letters of support and look at the other attachments and get those ready to go. So those are the pieces. It doesn't take me long to do this. Often takes me an hour or two to put all these pieces together. And then I'm really ready for my first meeting with my team because I'm like, here's our grant outline. This is what we're going to work. It's almost like your work plan for your grant writing. Here's the things we need to fill out with the work plan template, the budget template. You can send those out to the right people. So it's not a ton of work, but it is about carefully reading the RFP and getting these pieces right. So what do I put in my simple grant outline? It's just a Word document. I put the name of the grant on the top. I put the due date and the time at the top. And the big thing I put is the purpose. Every grant, especially federal grants, really clearly on the first page tell you the purpose. And that's like your North Star. The purpose of this grant is to do X. So if, you know, let's stay focused on that. I often will put the required activities. There's often like 10 or 12 required activities in a federal grant. So I just keep that in front of mind. Like, what are we going to do for those? And then I make a grant sections table. This is like my work plan. And in each of the sections, I note the page or the word limit for that sections and any specifications to be aware of. So this is what my grant table looks like. It's very simple. It's three columns, but I'll say, okay, we got to write an abstract at some point. Often the abstract in a federal grant is just copied and pasted into a box in the grant submission portal, but it often has a word limit or a character limit. Okay, so I got 1,000 words. So who's going to be responsible? Usually that's me. And then I want to know the due date. That's before the application due date. It's when are we actually putting our pieces together? Then I say, okay, we got a project narrative. It's 40 pages. It's double spaced and it has 5 sections, you know? Right. We need a work plan, 3 pages maximum. We got a budget narrative. And then I will list the attachments separately and go boom, boom, boom. What's needed? We have 3 letters of support minimum. We need bio sketches, no longer than 1 page per staff person, you know? And so I'm able to talk through at a really high level with my team. How are we going to do this? Who's in charge of the letters of support? Who's going to do bio sketches? When are we going to say these are due by? And we just like boom, boom, like grant writing is about being organized, getting these pieces. You do not want to get to submission day and be like, shoot, we needed bio sketches. You need to like very upfront know who is getting what and be very clear that it's all going to come together. Okay, so simple grant outline. Some grants provide you an application checklist. It's a very complicated grant. In the back of that RFP somewhere, they'll just have like a checklist that has the 35 things that are needed. That's actually nice. Another thing about some federal grants is they want your entire application package to only be a certain page limit, and that is hard. Because if you're pulling together a work plan and then the budget narrative and the narrative and all together, it can only be 60 pages, but different people are working on different things. You got to start checking in pretty early on and see how long things are. Sometimes they'll say these 5 things can only be 60 pages. And then the attachments, there's no page limit. So really pay attention to that, because again, you don't want to be working your butt off writing narrative that you have to cut at the end. You only want to do the work that you need to do. So really pay attention to that and make a plan to figure that out. And that's why I can't give you an exact template to do that. You have to just read the RFP really closely. Then this is my Bible, right? Is my grant narrative shell. I take a Word document. I put the exact, they often will tell you how many, the margins, like 1-inch margins. I'll put it in, Times New Roman 12-point font, double space, because that's what they tell you to do. I will put a page number. They will say number every page consecutively, starting with page 2. I mean, sometimes they're really specific. Okay, I'm doing that exact narrative shell so that as I'm typing, as I'm building this, I know exactly my page limit and where I'm at. Then I go to the questions, and this is my Bible. It's often 3 or 4 pages in that 80-page RFP. And I'm in my questions, my narrative questions. And I write the name of the grant at the top, the name of the project in bold. And then I do the first section name. It's often background or needs, whatever they say it, I use word for word their word. And then I do bullet points and I do it in italicized font of the questions I'm going to ask for that narrative. So I say, whatever the first prompt is, state the objectives of your proposed project. Prompt 2, briefly state the overarching needs you are planning to address. Briefly describe the target rural service area, right? So if it's 12 questions in that section, I boom, 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 bullet point, but I put them in italics because I'm going to delete them eventually after I've answered them. And it's crazy sometimes, sometimes with a federal grant, it'll be like, this is a 20-page narrative. And when you actually put the questions all together in the sections, it's like 5 pages of questions. So you start to realize I got to be concise here because my questions written out take 5 pages and I only have 12 pages of narrative. So I'm going to have to be to the point. So you start to understand how long. Sometimes I start to panic at this point because I'm like, oh my gosh, this is 40 questions. And some of these questions are really circuitous or hard to understand. But then what I do as a grant writer is once they kind of have a plan, the work plan, the budget starting to roll, I start to say to them, talk me through this, give me bullet points. Tell me organizationally information. Sometimes I say, do you have another grant you've already written that tells the mission and the history of your organization? Can you just send that to me? Like send me your organizational sections of some of your previous grants and I can start working with that. The background section you can start working on before you have the budget or the budget or the work plan, because you're often just pulling data to describe the need. And so if I have a client that's like really dragging their feet on getting me a plan to use the funds, I start with the background and that takes the longest anyway. So I start by writing that. Okay. Follow the exact formatting specifications and follow the questions word for word for word and in order. This is not creative writing. You are not choosing the order. You want your reviewer to be like, boom, 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 boom. Everything is in order. Everything is answered completely. And they know where you're at. Here's one thing to think about is foundations often are going to have you submit your answers into an online portal. So there's not like an RFP where you're developing a Word document. You need to answer questions in a portal, but often, almost always, you can download a PDF of the questions that you're going to answer and copy and paste into their portal with their little square. And so I recommend downloading that PDF and then making a Word document out of it. And they often have in a federal grant, they're going to have like a page limit specification. In a foundation grant, they often have every question has a character or um, a word limit specification. And so you want to count those. And if you highlight an area of a Word document at the bottom, they will tell you the number of characters and number of words you have. So keep checking that. Don't do a ton of writing that you're going to have to delete. So pay attention to each foundation question that you've downloaded from the portal, and really check your page limits. Okay. Work plan, budget, and letter of support. You want to make templates for those. Again, according to the exact specifications of the RFP. This is one I had that I pulled from a grant I wrote. And it's some weird wording, right? But they required this. They wanted you to have an outcome. Then they wanted you to have outcome measures that were called capacity measures for every outcome measure. And then they wanted what they called capacity strategies and capacity activities with a process measure, responsible party, and a completion date for each one, not data, completion date. So that's why I can't give you a template for the work plan. You have to read the RFP and say, what does this look like? Am I going to have goals? Do I have to have measurable SMART objectives under each goal? Often it's just then activities, and they want to know who's responsible or who's in charge of that. Sometimes, the metrics are kind of below each objective, and they're for the whole objectives. They're not at the activity level. I don't know. It's different every time. It's a pain in the butt, but you have to build that template. Sometimes it's downloadable right from the grant itself, and they'll give you that work plan. But I like to build it. They often let you, and pay attention to this, do 10-point font and single space when it comes to the work plan. So just build that template and then start putting in activities, as they tell you the things you're going to do. There's often a planning period. So you have to hire, you have to get your contracts in place, you have to train people, you have to engage your partners. It's not rocket science. You just have to think as a program person, what would I do to get this work done? And then start to build that work plan. So that, to me, the work plan is really, really critical. And if you have a good work plan written and can justify the budget that supports the work plan, the grant writes itself. So I love a good work plan. Again, most grants are going to have a budget line item and narrative template ready for you. This was one that I pulled from a grant that I wrote. And you just got to get this to the fiscal person and say, hey, put this in here. They often will tell you the categories they'll fund. So they fund personnel in this grant, training, if there's contracted services, if your evaluator is contracted, that's there. And then, other, look at your allowable costs. Here they're asking about match, and then they want just the narrative justification right in there. Sometimes it's a whole separate document. So there'll be a budget template and a budget narrative and justification. So pay attention to that, read it carefully, and then just build that template and get it filled in. I check it as a grant writer and I'll be like, okay, this is fine. You have this budget, but you don't actually have the required staff person, and it can't be in kind. So we have to get that staff person's salary at a 0.5 FTE in here. Again, you do not want to submit a grant that doesn't meet the basic requirements, that you're basically saying, don't fund me, And so unless you're meeting those very basic requirements and it's clear in the budget that you're doing that, or the other thing is if you're asking for a bunch of unallowable costs, they're just going to say no, so check that and make sure that you're setting yourself up for success. Letters of support, I think, are always a pain. I imagine if you are the head of organizations, you're constantly being asked for letters of support. And so I say, make it so easy for your partners. Call them up, tell them what you're doing, tell them what you'd actually want their role to be, but then give them a template, write it. Say, just add your letterhead, here's the date, here's who we want it from. And then, put the name of your funding opportunity in there, give that justification, and then often read the requirements of the letters of support. Sometimes lately they've been really specific of like, you actually have people who are they need to commit to being part of your coalition, or they need to commit to actually providing in-kind funds or something. And so again, make sure your letters of support really meet the requirements. And then give them that template and make them super easy so you can get those letters of support back, and pay attention to the number that you need so you make sure you have that met as well. Okay, I found the most like headache kind of picture I could find here because editing, I say this later in document management, are my 7th circle of hell as a grant writer. It's just hard. It's hard. What submitting a grant looks like is getting your documents that a whole team has worked on, getting them in the right format at the right time to submit. And so you gotta, as a team, have a plan for document management, okay? These are just my thoughts. Keep the contributing team small. If you have a bigger group in your organization that's like discussing the plan for the funds, great. As many people as you need at the table. But when it comes to actually hands on the document, comments on the document, keep that team small. Really designate a program person, maybe a fiscal person, and then one admin who's actually in the document messing with it. If I have 20 people in my document, dear God, written, and they're all commenting and then re-commenting, and they're commenting on things that they clearly haven't even read the grant and they don't know what they're talking about, I just want to scream, right? So keep that team small that's actually messing with your documents. Let your grant writer or your key program person start to resolve comments and edits. Don't just track changes. Dear God, you can't even read track changes. Sometimes if you start to accept changes, the document, you lose a page, like what is even happening? So, people can make edits, but if you have a trusted editor, just let them edit. They don't need to like track every single change. And if there's comments that can be responded to and resolved, just do it, resolve it. You got to get to the point where you're going to submit. Have a point person who's like in charge of that. They're gathering, they're editing, they're finalizing, they're cleaning things up. They're getting stuff into the right format. That can be your grant writer or your key program person, but have somebody who has that final authority on the documents and is like cleaning them up. And then, you often will have a shared document kind of set up, and you can have your research and you can have your drafts, but you need that final documents folder that you're putting the final right document with the right naming, the right name into the final folder, and then it's not touched. No one else is editing, is doing anything with it. And you need someone really paying attention to, do we have all the correct final documents in the final folder before we submit? So just pay attention to that and have that conversation. Okay, I am checking time. We're doing great. Okay, clear, structured, technical writing. This is the thing you have to write. We're going to talk a little bit about AI. But this is hard, you got to use the right technical language for the field, but don't get too technical. You want to know your funder. If you're writing for the Montana Healthcare Foundation, you darn better well be speaking their public health technical language. If you're writing for the Dennis and Phyllis Washington Foundation, you're going to have to explain what public health is kind of, and the why, right? So know your funder and how technical they are. If you're writing a federal grant, again, use the right language. Just know your field and be speaking the words that they know you should be speaking. Use data. We'll talk about that. I do basic simple citations, but cite. Use bullet points, bullets. Be clear, concise. But when you're doing a long narrative, just use bullet points, graphs, tables. And then use the language of the RFP. Don't be cute. If they have an overall purpose, then your purpose is basically to do that in your organization. If they have a goal, your goal is to do that in your organization, right? Or with your partners or in your geographic locality, right? So your purpose, goals, and language should almost exactly mirror what the grant is saying. You can make some changes to show you've thought carefully about it, but you do not need to be like off in left field to be fulfilling the purpose, goals, and objective that the RFP wants to fulfill. This is not creative writing. You are not writing a novel. You are not being an imaginative. You are not, wowing them with your flowery language. You are being technical. You are being clear. You are being straightforward. You're fact-based. You're data-based. And you are really letting them know that you are a public health expert coming in to do great work using evidence-based practices. Remember, Your grant reviewer often doesn't know your program. At the federal level, they bring in people from other programs. So they have like general public health expertise, but they are not the asthma people reviewing the asthma grants. So don't, and then especially foundations, don't assume that they have the background knowledge of your program. You know, I love this, like explain this to me like I'm 5, like be clear, don't dumb your language down, but be very clear about what you're doing. Your job is to concisely and clearly answer every single prompt in the order they are given. Okay. Don't be cute about it. Make it easy for the reviewers to give you full credit. They should be able to go check, 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 and be like, oh my gosh, they fulfilled every requirement. They answered every question. Graphs and tables are your friend. Visualize your staffing plan. I love staffing plan visual. Or if you have a coalition, it's great to like show your coalition, love a logic model, map out your services, put complex data into tables. Don't run on for pages and pages trying to describe data. And that can also save you space. Often tables and graphs are allowed to be smaller font, single spaced, and so it saves you time. Hardest part about grant writing is that writing is hard. Sometimes I'm sick to my stomach. have to write, and I just think it's hard, you know. I love this little grant this little visual because it's like, ugh, it's so easy to be distracted. So these are personal tips. This is not any professional knowledge except for my many years of doing this. Don't try to start writing the narrative until you're ready. I like to be very clear. Like I like to have a whole day set aside where I've looked at the budget. For the most part, it's almost finalized. My work plan is almost finalized. And then I'm just like head down. I'm going to write this narrative now. You know, I have clarity of what we're doing, and now we just need to get words on paper. We talk about deep work. I think you need 2 to 3 hours of focused, structured writing time to get anywhere. I think you should try to write almost a whole section of your grant, maybe 5 pages in one sit down. That's what works best for me. And I think the reason people need grant writers is we have so many dang meetings in public health that nobody has 2 to 3 hours to do the work. If you have, I give myself 6-hour days, and if I have 2 or 3 of those, I can knock a federal grant out, but it is focused time that I have no meetings. I'm not stopping. I'm like head down. I've done my background research. I'm ready to go. Put your head down and write. I tell myself this, keep moving. I don't get stuck on the fact that I don't know something. I'm a grant writer. I don't know your program perfectly. So I'll be typing something and I'll be like, this program was started in, I have no idea when it was started. And I put an X, I highlighted it, and I keep moving. So don't get stuck on editing, re-editing as you're writing, and don't get stuck on what you don't know. Put an X, highlighted it, and just keep going. When appropriate, you can use those previous applications, boilerplate language, right? You should have a good organizational overview that you use in all of your grant applications. And don't be afraid to utilize those. Hopefully, once you start writing some grants, you have some good background of your program, background data that you can kind of use. Don't just copy and paste, think carefully, but you can use that. Set goals and reward yourself. I'm like, I will tell myself today I am writing this background section and we work right above a really good coffee shop. I'm getting a coffee when I'm done, you know. This is another one that's really helps me is there are drone music playlists on Spotify. I don't know what it is. Maybe this won't help you, but it's just like I don't know how to explain it. There's no words, but it is the best writing music. So find a drone music playlist, try it. You know, may not work for you. In the chat, what are your best writing tips to actually get words on paper? How do you motivate yourself? Okay. Things quickly about filling in the narrative template. I keep all the grant headings in order. So keep those. Keep the headings. Name that project. You probably may not ever use that name. I make up names all the time for my client, but like this is the Healthy Kids in Cascade County project, you know, and then just keep referencing it. I often italicize that project name throughout, but you don't just want to say, we're going to do this thing. Don't be general. Be like, in the Healthy Kids in Cascade County project, we are going to do these things, you know, like name it, give it like, speak it into existence. Use that active voice. We will do these things. We will accomplish this. Not like if we get funding, we might. No, be active. Talk about it like you have already received the funding. Then you answer those questions in order and you clearly restate the question so that you're going to delete this part. You're going to delete this, right? So what you need to say is the objective of the Healthy Kids in Cascade Montana project is, the objectives are, you know, and then you're going to answer that bullet points. What are your objectives? Then you will say the overarching needs for Cascade County to address this project are, right? So restate the question. And once you've answered it, delete the actual italicized question. You don't need those questions in there, but your reviewer needs to understand that that's the question you're answering. Okay. The target rural service area for the Healthy Kids in Cascade County project is, they need to know as they go down that you're answering the question and it needs to be restated, right? So one by one, fill it out and delete the prompts once they're in order. Focus on clearly and concisely answering every question and have heart and insight. Show them you care. Show them you've been doing this work. You're the experts. Don't just be cold about it. I think especially with AI, it can just be like blah, 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 robot. Like, no, show them your passion, let that come through. Once you have a draft, you got to edit that thing for grammar. I am such a good big picture thinker. I'm terrible at grammar. There's people use things like Grammarly. I love to just have somebody who totally is an outsider, but who can just really do an edit for grammar for me and spelling. And it's just got to be done. And sometimes you're too close to it. You got to have someone else look at it. And then you want someone to actually review it for content and fit. And your grant writer can do that, just like review all the pieces and make sure they align. Helpful to have a new set of eyes. You get too close to these things and your eyes start to cross and you're not really seeing it anymore. Sometimes you just need to ask, like, does this make sense? No, like it might make sense in your head, but you've been too close. Then once you're close to the end, you got to get that scoring checklist out. And you have to have somebody yourself probably, but it's also good to have someone who knows nothing about the program, like who would be a reviewer, pretend reviewer, say, are we answering these questions? Will you read this through and make sure that we will get all the points and tell us where there's some weak points that we can tighten this up. Okay. I have to be pretty quick here. Using data, it's just important to have data in public health. You got that background or data section. It often takes the longest to write. I think in my mind, it often takes, unless you have great data already at your fingertips, the background section takes about 50% of the time for writing the grant. And then for me, at least, the other 4 or 5 sections takes the other 50%. So the background is hard, especially if you have to go find that data. So start working on that right away. It can be written before the budget and work plan are finalized. Know your epidemiologists, evaluators, and GIS people. I know these people at the state. I call them. They are my buddies, and sometimes they can get me data so fast. I did a data request yesterday for the hospital data discharge system, and I got the data turned around in like an hour. She did like a native analysis for me. It was incredible. So those people are amazing. Use existing data reports and dashboards. This was an oral health grant I wrote, and we just like we took a PDF and took pictures of this data that they already had for the program. We used the figures that they had, and it was great to be able to justify it. And the visual, I think, breaks up your narrative. So use those existing reports and dashboards. And if you know you're going to start doing applications, gather data, know some data, know what's going on. In Montana, I think we're getting better at this, but start looking at your programmatic data now. Get a sense of the need. You really shouldn't be going after funding unless you know the need. And use that programmatic data whenever possible. Show them that you have been doing work and tracking it, and you know the outcomes of your own data. Use those evaluation findings from trainings. Use your local YRBS findings for youth. So as much programmatic data as you can is great. And then, writing technical data reports is a skill. So read them. Read the data in your field and know what it sounds like to describe data. I don't know. You just have to know what public health data reports sound like. So read what the epidemiologists at the state are putting out, and understand how they're talking about the data in your field and how they're citing their sources. Don't trust AI. Oh my gosh. I've been trying to sometimes use AI, but especially for local and programmatic data, it is so inaccurate. So just be really careful about that. When in a pinch, sometimes we don't have local data. This was a pregnancy death um, mortality review, and we didn't have the Montana data yet, but we were able to show that American Indians nationally had some much worse outcomes. So sometimes you just got to use that national data. And then you got to edit. And that's hard. Again, I just say that's my 7th circle of hell. And this is kind of similar to document management, but who is the finalization lead? I often will say, I've got you 90% there. I got your narrative as close as I can. We don't need to go back and forth editing it and getting it to 100%. I'm going to hand it to the programmatic person and they're going to make sure it's okay. Often the program, I want them to own that final step because they're the ones who have to own the submission and are hoping to get funded. So give it to that lead program person and let them finalize it. Accept those changes, keep the document clean. I think there should be deadlines for edits about 2 to 3 days before the final draft is due, or before the application is due. So that you can do that tie up. You have to do that look across to make sure it works. So before submission, the finalization lead should review for that alignment. So that's why you need those 2 to 3 days. Is this all speaking to each other? All these pieces, are they all talking to each other? You got to ensure that the formatting is correct. The file naming convention. It is weird, but in federal grants, they will often tell you, you have to name these files, these things. They have to be PDFs. They need to be underscored between each name. It has to say attachment 1 / submission or letters of support. So like just little ticky taxy stuff like that. If you go to submit and then often the grant portals will reject your documents if they're not in the exact right naming convention. So don't get lost in that. Make sure they're in the right format. Again, they will often tell you what format you can have your documents in. And then save it to that one folder, baby. Those are final documents with the right naming convention, the right format, the final. And then use that grant outline at the end to just make sure, or the RFP checklist to confirm you're all there. And then check the time zone for the submission, especially on Emacs. It's a Montana-based system, and they often have an Eastern Montana time zone to submit. So I have been in a panic in $1 million grants before where we thought we had 2.5 hours to submit, and we had 30 minutes to submit because we had read that submission was 5 p.m. and that was 5 p.m. Eastern. So just be very careful about the time zone because that has caused me some heartburn. Okay, submission. Understand how to submit and get registered ASAP. You often aren't the person to submit. There's someone in your county who does it. There's a grant person who does it, and you have to have a registration. So get that. Understand who has that authority. Get on their calendar now. This might be a person who you don't talk to at all the whole process, but you got to sit down with them and you got to have that folder ready and you got to do that submission. And you might get error messages and there might be all sorts of problems. So you got to say 48 hours before, we're going to sit down, we're going to try to submit. And you got to get on that person's calendar, get them all in one folder, make sure it's an accessible folder with the submitter, not just with you. And then at least 24 hours before the deadline. Okay, the final thing I'm going to talk about is grant writing and AI, guys. Am I going to have a job? Are any of us? Is AI going to replace grant writers? I think there's really good use cases for AI. I think those search engines are going to get much more optimized with AI. They're going to help you actively go out and search for opportunities, which is great. I think AI can really help people with drafting language and editing. I think you can put your drafts into AI and get some editing advice. And I think you can start to train your own AI with previous proposals and with your internal documents to understand your organization and have some of that boilerplate language ready to go. So I think that's helpful. There are actually and I actually asked my co-working space and no one knew, but there are whole companies. This one is called Granted, and it is an AI company to help you do grant writing. I don't know how much it costs, but they have literally put 500,000 successful grant proposals into their AI and trained this AI to start writing grants. So it's a thing and it's coming and it's going to be coming more. I was thinking about this whole project as I was thinking a lot about my own process. AI can't do some things. It cannot assess if this grant will actually work for your organization, right? You have to know that. You have to know your actual staff. You have to know your actual partners. You have to know your administration and if they're going to get in your way and make it impossible for you to use the funds, right? So they can't assess that. It can't get that internal and external support. Maybe on paper, you could do this. But if you have partners who will not come to the table, if you have staff who are like, I'm not doing one more thing, don't you dare ask me. AI can't know that. You have to know that and manage that and understand if you have the support. And it could probably come up with a plan to use the funds, but you have to know if this is actionable, feasible, if staff will accept it. Often there's required staffing and you will know if one person can do it or if it'd actually be better to give 3 people this role and have them share the different parts of it. You are the only ones who can make those decisions. Successful grant writing is a process of planning, thinking, and partnering, and that can't be offloaded to AI. So do that human work. If you're going to use AI to write a grant, I think you should, and I've been thinking about doing this with my work, but then I'm a little bit reticent, but you have to pay for an AI that you can train. So you want to upload all your previous grants, you want to upload your reports, you want to be teaching your AI about your own program. And I think you would then upload the RFP to the grant. And I think eventually it might be able to build those templates for you and the narrative outline and things, maybe. But again, you'd have to check it and make sure it's actually accurate. Upload all of these things. I think you could upload your narrative and the RFP and ask it to look at it and edit it and give you feedback. A lot of times AI is just going to give you the most bland medium thing though. And so just be careful. I would say really don't trust it for data. I've been trying to, especially local data. You got to look at those dashboards and know your data limitations and know Montana data and know when data is suppressed and all of those things. And then don't, accept bland and personal writing without heart. You got to put your heart into this. You have to have that human aspect of the care, of the expertise, of the excitement that you have that really makes your grant stand out. Anything else, if you guys have thoughts on AI that you would add? I don't have a ton of experience like with this. One thing I've found is sometimes if I'm like, we're going to do an evidence-based program, this teen pregnancy prevention program that's well known nationally, I'll say, give me a summary of this teen pregnancy prevention program, and it can go find that because it's national. Lots of people use it, and it'll write me a little summary, and I can take pieces of that and pop it into my grant if they're just saying, describe your evidence-based practice you're going to implement. But also you can find that on a website and cite the website. So I don't know. I don't know, but I have used it a little bit with those kind of things. Remember, human intelligence is embodied intelligence, and grants are going to be funding embodied work that has to land in your community, that has to be accepted in your community. So don't submit a grant that doesn't have heart, intention, or that leaves out the lived experience of those who will benefit or participate in the grant. You want to represent them well and not just have it be what an AI thinks would work. You want to actually be really engaging your community and talking to them. So, and have that come through in the grant. In conclusion, you can do this. I believe in you. Grant writing is not rocket science. You can get organized. You can be thoughtful. You can make a plan with your team and just answer every single prompt and have a clear budget and work plan that all lines up, and you can get funded. It can absolutely happen. I've seen it happen many, many times, and I don't necessarily think you need a professional grant writer. Something I think that all public health professionals can do. All right, we have 3 minutes for questions. Was there anything, Desiree, in the chat?
The only question was if you are going to upload the slide deck into the portal.
Am I able to do that as a handout, kind of? Yes, I would love to do that. And happy to do that as soon as we're done here today. So, yeah.
One question, have you found it useful to review what foundations have successfully funded in the past to help with submitting one?
Yeah,
And
go ahead.
how do you feel about asking for feedback from non-federal when not funded?
Oh, that's a good question. I actually do think often with federal, you can see your scoring of a non-funded application is super worthwhile to look at that. So look at those funding and see where you got low scores and be like, oh shoot, we missed that. We need to, or they didn't think we had robust enough partners, or so definitely review those. And I think the same with foundations, if they're willing to give you a list of who they funded, or review applications. Other thing I think that's helpful if you can find partners is like find another state or another county that got that funding last time and be like, would you be willing to share your funded application with us? And just see what a successful application looked like. So I almost think it's more useful to look at a successful application to know what is getting funded. And so if you can find someone who's been successfully funded and if they'll share their application with you, it's really common for folks to do that.
So will federal easily share their scoring of the application?
Yes, almost always you get that back. So for a funded and a non-funded application, you'll get your scoring back and you can review it.
Any other questions?
Awesome. This is me. I'm available. I also have a staff person up on the Fort Peck Reservation who sometimes helps me with some grant writing and especially works on projects in Native communities. But would love to chat with anybody, even with this presentation, if it's something that would be useful in your organization or something. I'm happy to share it. Or is there going to be this recording available as well online? Okay.
I'll have it on the website.
Yeah. So yeah, this is my experience. I know other people have different ways of approaching this. I don't think there's any right or wrong way of approaching it other than just saying be systematic, get a good process in place, and make sure you answer all the questions. So,
Perfect. Thank you so much, Katie.
yeah,
This
thank you for your time today, guys.
so much good information. Thank you.
Yeah,
Thank you. Thank you.
awesome. Okay, have a great day.
Thank you, Katie.